Go ahead, ma'am.
Yeah. So, good evening, everyone. I'm Dr. Sayali. I'm the consultant and fertility specialist at Oasis Fertility, Pune, at the Karadi Center. So, in today's Facebook Live session, we'll be dealing with expert advice on menstrual hygiene, infections, and infertility. So first coming to menstrual hygiene, globally we have around 52% of the women who are in the reproductive age group. Now it's basically these women in the reproductive age group, be it girls or women, they are going to menstruate every month. So basically they are going to have their periods every month, which is going to come every 21 to 35 days, and they're going to bleed for a period of 2 to 7 days. So during this menstruation, the girls and the women have to face many social, cultural, and religious restrictions, and these are basically one of the biggest barrier in them maintaining the menstrual hygiene. So, in many parts of our country, especially in the rural areas, these girls are not aware of the menstrual practices. They do not know about menstruation. They do not know about how they're going to be prepared for the menstrual cycle. How they're supposed to take care of themselves during the menstrual cycle. So basically, these individuals face many difficulties during their menstrual cycle, especially in maintaining their menstrual hygiene, be it at home, be it in school, or at their workplace. Now these individuals, they do not have much knowledge about the the breach in the menstrual hygiene, resulting in reproductive tract infections, and resulting in problems relating to fertility in the future life. These individuals do not have very much access to the sanitary products that are available. They do not have much knowledge about the variety of options in the sanitary products that are available, and basically many of these individuals, they are not able to afford these sanitary products. Coming to the menstrual hygiene, first let us understand what menstruation is. So, typically, when a girl reaches puberty around the age of 10 to 18 years, she will have her first periods. Initially, these periods are going to be irregular for the initial 1 or 2 years, and then she's going to have every monthly her cycles are going to come maybe every 21 to 35 days, and she's going to bleed for a period of around 2 to 7 days. Now, most of these individuals have regular menstrual cycles. That is, the menstrual cycles are going to come monthly. Only in a few individuals who have some hormonal abnormalities in the form of PCO, individuals who are obese, or who are undergoing through a lot of stress or some eating disorders. Only in these individuals the menses may not come regularly, on a monthly basis. Otherwise, most of these girls, most of the women, they are going to have menses every month. Now you have to understand that in a menstrual cycle, there is a phase which is known as ovulation, which comes around 14 days prior to the onset of the next menstrual cycle. So considering a menstrual cycle which is of around 28 days, we will have ovulation, which involves the release of the egg from the ovary. Now, following the release of the egg from the ovary, if this egg is not fertilized by the sperm and there is no pregnancy, the uterine lining that is developed in order to support the pregnancy and to carry the pregnancy forward, this lining is going to be shed off. And this lining is shed off in the form of menses, in the form of blood. Now, this blood passes off through the vagina. So, this is basically the uterine lining that has built up to support our pregnancy if it had occurred, and this lining will be shed every month. Now, this bleeding, as we have already discussed, usually lasts for a period of 2 to 7 days. Now, menstrual cycle, when we say, is considered a taboo in most of the areas in our country. Now, these individuals, find it very difficult to even carry on their day-to-day activities during the menstrual cycles. They cannot attend any religious functions. They cannot attend, visit any temples. Basically, these individuals have to stay separately, from the other family members. They are not allowed to cook in the family, and because the menstrual blood, that is the period blood, is considered to be impure, according to many of the individuals. So there are, many common myths that are associated with the menstrual cycle or menstruation in our country. They consider the menstrual blood to be impure. Now here they have to understand that the menstrual blood is not impure. It is basically the uterine lining that is developed in every woman so that if the pregnancy occurs, she is able to support her baby. There is a common myth that these women who are menstruating, they cannot attend any temples, they cannot take part in any religious ceremonies, they cannot cook food because they consider the food to be spoiled, or they consider even the food that is cooked by them to be impure. So all of these social taboos that are there, all of these religious and social restrictions that are there, they make it very difficult for these individuals, for the women to be open about their menstrual cycle, and they make it very difficult for these women to get access to the basic care that is required during the menstrual cycle and basic facilities that are available, and therefore this becomes a major obstacle for them in maintaining the menstrual hygiene. Now, why is the menstrual hygiene important? Now, as we have seen that every woman will, have a menstrual cycle every month, starting from the pubertal age, till the menopause. That is till her periods stop or till the uterus is removed for any reason. So it's a long duration. Now, here she has to keep, take proper care of herself during the menstrual cycles because she has to prevent infections. Now, when she's using unclean sanitary pads or any form of sanitary materials, as we have seen that most of these girls or women living in the rural areas, they do not have access to the sanitary products or they are not affordable for them. So they basically use these cloths that are used during the period time. So these cloths or the or the the unclear this unclean sanitary pads that are there, they can be a source of infection. Now these products can lodge the bacteria, and these bacteria can result in local infection at the site, or this infection can even ascend and they can travel up the vagina, and then they can enter into the uterine cavity, they can enter into the tubes, and they can cause infection of the entire reproductive tract, and this further will hamper their fertility. Now, these pads that they're using, they should be changed on routine basis. They have to be changed every 2 to 6 hourly, depending upon the amount of blood flow. Because the wet pads that are there, the dampness can result in skin moistness, skin irritation, and can result in infection. When they are using other sanitary products, like instead of pads, if they're using any form of tampons, if they're using the highly absorbent tampons, that can result in accumulation of these toxic metabolites and can result in something that is known as toxic shock syndrome. Especially when these individuals are using tampons when they are not bleeding. Now, these tampons are going to absorb, all the vaginal secretion. They're going to result in dryness, irritation, itching, and they can result in infections when they are having unprotected intercourse during the menses period. This increases the risk of transmitting the sexually transmitted infections because, the uterine cavity, there's direct access to the organisms, and even there's a risk of transmitting these infections to your partner. Unsafe disposal of your sanitary products. This also increases the risk of infection to the other individuals who are getting exposed to these products. Frequent douching, that is, frequent forcing of liquids into the vagina or frequent washing of your area, that can result in introduction of the organisms, introduction of bacteria into the vagina, and these bacteria or organisms can travel through the vagina and they can enter into your reproductive tract. So basically, we have seen how not maintaining a proper menstrual hygiene can result in infections. So how should we maintain the menstrual hygiene? So to maintain a hygiene during the menstrual cycle, the woman has to concentrate on a well balanced diet so that her immunity is not compromised. So even if there is any form of infection, she is able to fight with it. She has to take a bath at least once in a day with a mild, intimate wash, and she has to wash, her lower area every time she uses the washroom and pat it dry. use clean, light cotton undergarments and regularly change them. Whenever the undergarments are stained, they have to be properly taken care of. Change the pads regularly. As we have said, the pads should be changed every 2 to 6 hourly. And here we have variety of options in the sanitary products. So they can be the reusable sanitary pads or the disposable ones. We can have the vaginal tampons, we can have the menstrual cups, or even the cloths that are used by variety of by many individuals. Now here you have to understand that stick to one sanitary method at a time, and stick to one brand at a time, because you cannot continuously keep on changing or adding on multiple options. Because use what is best suitable for you, because that is going to that is going to be suitable for you, and you are like not going to have any infections, or so use of one brand at a time, and use of any one product, be it sanitary pads, be it your menstrual cups, or be it your tampons. Ideally, the individual should avoid the use of a cloth during the periods. But supposedly, if the individual is using it, you have to take care that the cloth is properly cleaned, and it has to be regularly changed, maybe every 2 to 6 hourly, and it has to be properly washed with an antiseptic solution. So coming when sanitary napkins or sanitary pads are the most commonly used method of during the menstrual cycle. So how should we dispose these sanitary pads? So you should ideally wrap them in a piece of paper, and you have to throw it in a dustbin. Ideally, please do not flush, because this will result in choke up of your drainage. And whenever you are disposing these pads, make sure that you wash yourself up, you clean your hands after the disposal. Now here we have seen that maintaining the menstrual hygiene is very important in terms of the woman's health also, and in terms of long term fertility for the woman. So there are a variety of infections, especially they can be in the form of bacterial infections, they can be in the form of viral parasitic infections, or fungal infections. Now these infections can travel up the vagina, and they can infect your reproductive tract, they can infect your tubes, they can infect your ovary. So now these infections, like if your menstrual hygiene is not properly maintained, then these infections can even affect your fertility. Now, every individual has this vaginal defense against any infection. So, our vagina tries to maintain an acidic pH. So, this acidic pH will prevent the growth of other organisms, and there is this vaginal discharge, that is a clear discharge that will prevent, it's like a washing off thing that will prevent the organisms from thriving here. So any change in the color of the vaginal discharge is from a normal transparent discharge to greenish, yellowish discharge, or any form of whitish discharge, or change in the smell of the discharge. If it is foul smelling, or if it is, it has a fishy odor, if it is associated with itching, irritation, if it is associated with any form of swelling, this kind of indicates that there can be some form of infection. Type of infection, as we have seen, can be bacterial infections. Here we have the chlamydia and gonorrhea. These are the most commonly occurring sexually transmitted infections. This can be, other infections can be in the form of fungal infections like candidiasis, parasitic infections like the trichomonas infection, or we have other forms of infections like the viral infections, that is the herpes infections. Now, the most common form of bacterial infection is basically the bacterial vaginosis, which is caused by the Gardnerella organism. And other form of bacterial vaginitis that can be caused by sexually transmitted infections such as the chlamydia trachomatis, that is the chlamydia infection, or the gonorrhea infection. Now these organisms, or these infective organisms, now what they do is they locally infect the vagina, and through the vagina they can enter into the uterine cavity, spread through the fallopian tubes, and they can result in damage of the fallopian tube, they can damage the uterine cavity, they can cause infection of the fallopian tube in the abdominal cavity, that can result in adhesion, and they result in a condition which is known as a pelvic inflammatory disease. Now, this pelvic inflammatory disease, basically there are going to be adhesions, or it's, your uterus, the tubes and the ovaries are going to be stuck up inside the abdominal cavity. The tubes might be swollen, the tubes will be damaged from inside. So basically the process of formation of the embryo, that is the pickup of the eggs by these fallopian tubes, the fertilization process that takes place in the fallopian tube, this is hampered. Sometimes the tubo-ovarian relationship, that is the relationship which is required for the pickup of the egg into the tube, the sperm to travel into the tube and form the embryo, and for this embryo to go and implant into the uterine cavity, this tubo-ovarian relationship can also be, impaired in a pelvic inflammatory disease. This pelvic inflammatory disease can also result in scarring inside the uterine cavity. So this can constrict the cavity, and it can again affect the lining of the uterine cavity, and this can kind of impair the process of fertility. So here the process of fertilization, formation of embryo, or the process of implantation will be affected. So basically, when the tubes are damaged in individuals with PID, there is increased chance of ectopic pregnancy, that is the pregnancy residing, in places apart from the uterine cavity. So now we have seen the bacterial infection. Coming to the fungal infections, here we have candidiasis. Candid infections, or these fungal infections, at least three-fourths of the women have experienced this form of infection sometime or the other. Now these are basically the secretions of a candid infection are thick, they are white, like a cottage cheese appearance is there. They are odorless. They can result in pain, irritation, and itching at your vulval vaginal side. Now these infections, they basically alter the vaginal pH, and they are going to affect the sperm ascent to the vagina, and they are going to decrease the chances of fertility. The bacterial infections that we have dealt with, they also affect the male partners, and they can result in inflammation of the urethral area, and they can even affect the seminal parameters that are there. Now, what are the basic causes of these infections? This can be caused by the use of any form of vaginal creams, any form of perfumes, or in these areas, douching is there, any hygiene products, any form of lubricants, unhygienic menstrual practices, or the use of multiple sexual partner, or the use of intrauterine devices. So all of these can, they can affect the local, barrier that is there, and they can result in these infections. The symptoms in the, bacterial infections can be in the form of foul smelling vaginal discharge. There can be irritation, itching, and there can be erythema or swelling in that area. Uh, Another form of infection is the parasitic infection, which is caused by Trichomonas vaginalis. So the parasitic infection, Trichomonas vaginalis, it comes with basically symptoms of genital itching. There's a foul-smelling vaginal discharge. The individuals will complain of painful intercourse, or swelling and pain and irritation in this area. Now, this Trichomonas organism, this usually affects the lining of the uterine cavity, and therefore the uterus or the uterine cavity is affected by this individual, and this can affect the the pregnancy success, and it can affect the implantation process, or it can increase the and can result in increased risk of miscarriages. Coming to the viral infection, herpes simplex virus infections can also, these can also kind of infect the reproductive tract, and they can result in infections. So basically, we have seen, so be it bacterial, be it parasitic, be it fungal infections, there's a complex relationship between these infections and infertility. So basically, these infections, they affect each and every part of the reproductive tract system, and the vaginal infections, they basically result in endometritis, that is inflammation of the uterine cavity. They can affect the tube, resulting in salpingitis. They can result in adhesion formation, especially in these pelvic inflammatory diseases. So these adhesion formations will be there. They affect the tubo-ovarian relationship. They result in formation of infective fluid inside the uterine cavity, and the fallopian tubes, and they can overall affect the process of fertility. In males also, we have other organisms such as the gram-positive cocci, those are the staphylococci and the streptococci, and these are going to cause epididymitis and prostatitis, that is swelling of the male reproductive tract system. And because of these infections, basically the seminal parameters are going to be affected. This can result in decrease in the quality of the semen sample, and this can also impair the chances of conception. Another infection, that is the enterococcus infection, this can also alter the seminal parameters. So in the session, as we have seen, that menstrual hygiene is absolutely important, even in a country like India, where there are several taboos and several restrictions that are related to the menstruation. The women have to take care of themselves during the menstrual cycle. They have to maintain their menstrual hygiene, so the fertility in the near future will not be affected, because as we have seen, any breach in the menstrual hygiene practices can impact the fertility in these individuals, and they can have side effects in the near future. So I hope this session has been informative and it has cleared most of the doubts of these individuals. So I think this is all that I have from my side. Let us see if you have any questions coming over from our viewers. Okay, so the first question we have is, can wearing a pad for too long cause infection? Yes, so ideally, as we have discussed, that you should change a sanitary pad every 2 to 6 hourly, depending upon the menstrual flow. Should not keep it for more than 6 hours, because the longer you keep it, the more the organisms are going to thrive on it, and this can result in local infection or even the ascending infection that can impact your reproductive system. Okay, so the next question is, can menstrual infection stop ovulation? Uh, so this is a very indirect question. Menstrual infection ideally will not stop ovulation, but it can impair the chances of conception. Okay. The next question we have is, how can I prevent menstrual disorders? So the menstrual disorders can be because of a variety of reasons. So there are individuals who have irregular menstrual cycles. So this can be because of hormonal disturbances in the form of polycystic ovarian syndrome, or it can be related to stress. It can be related to obesity, eating disorders, or individuals who are working out a lot, okay, or who are eating too much or too less. So if it is because of stress, you have to kind of curtail down your stress level. If it is because of eating disorders, you need to eat the right amount of food. Obesity, you need to decrease your weight. If it is because of hormonal disturbances, PCO comes with obesity, it comes with insulin resistance, so you need to have your right kind of food, you need to exercise. And if it is polycystic ovaries, then you can take in medications to regularize your menstrual cycles. Okay, so thank you everyone. I hope the session was informative. So for any help needed, you can dial the helpline number that is given below, or you can reach us physically at any of our two centers, that is Oasis Fertility at Kaspate Vasti at Wakkad and Arasa Avenue at Karadi. Thank you.